Tonight, while you are sleeping, your brain is either recovering or quietly being damaged. And the difference between those two outcomes may come down to something as simple as which direction your body is facing when you close your eyes. Most people never think about sleep position as a health issue. They find what feels comfortable, they stick with it for decades, and they assume that as long as they are getting enough hours, they are doing fine. But here's what the research actually shows. 30% of all strokes happen between midnight and 6 in the morning, not during a stressful workday, not during exercise, while you are asleep. And the position your body is in during those hours has a direct effect on blood flow, oxygen delivery to the brain, and the pressure inside your skull. I am Dr. Michael Lin, and welcome back to Dr. Michael Lin Senior Health. Today we are going through 5 sleep positions that may be quietly increasing your stroke risk, ranked from concerning to the most dangerous. And then I'm going to give you 2 specific positions that research suggests may genuinely protect your brain and your heart while you rest. I will also walk you through a few simple bedroom changes that cost almost nothing but can make a real difference in how well your cardiovascular system recovers during sleep. Before we start, I want you to do something for me. In the comments below, tell me whether you are a back sleeper, a side sleeper, or a stomach sleeper, because in a few minutes, you will find out whether your habit is on this list. And if you are over 60, this is not just interesting information. It is information that may genuinely matter for your long-term health. But before we get into the positions, I need to explain a few things about what your body is actually doing while you sleep, because this context makes everything else on this list make much more sense. Most people think of sleep as the body simply shutting down for a few hours. In reality, sleep is one of the most active and important periods in your entire day for both your brain and your cardiovascular system. While you sleep, your heart rate drops, your blood pressure should naturally decrease, and your brain goes through a remarkable process of clearing out waste products that have built up throughout the day. Researchers call this the glymphatic system, and it functions almost like a cleaning crew that moves through the brain during sleep, flushing out toxic proteins, including amyloid beta, which is the protein associated with Alzheimer's disease. Here is why sleep position matters so much for this process. The glymphatic system does not work equally well in all positions. Research published in the Journal of Neuroscience found that side sleeping, particularly on the left side, appears to support this brain cleaning process more effectively than back or stomach sleeping. That means your sleep position is not just about comfort or back pain. It may be influencing your risk of cognitive decline over the coming years. On the cardiovascular side, your blood pressure is supposed to follow what doctors call a dipping pattern during sleep, naturally falling by 10 to 20% compared to daytime levels. This nighttime dip is essential for giving your blood vessels time to rest and recover. When sleep quality is poor, or when your body is in a position that puts unnecessary strain on the heart and blood vessels, that dipping pattern is disrupted. And people whose blood pressure does not dip properly during sleep have a significantly higher risk of stroke and heart attack. With that foundation in place, let us go through the 5 positions, starting at number 5 and working toward the most dangerous. Position number 5 is sleeping completely flat on your back with no elevation at all. This one surprises people because lying flat on your back feels natural and neutral. Your spine is straight, there is no twisting, and for younger adults, it often works well. But after 60, the picture changes. When you lie completely flat, blood tends to pool toward the head because gravity is no longer helping it return efficiently to the heart. In a young person with flexible, elastic blood vessels, this is handled easily. But after 60, blood vessels naturally become stiffer and less responsive. The small arteries inside the brain become more fragile. When blood pools in the head for 7 or 8 consecutive hours, pressure builds inside the skull, and that pressure can interfere with the delicate blood flow that keeps your brain nourished and protected throughout the night. Have you ever woken up at 2 or 3 in the morning with a dull, pounding headache? That is not random, and it is not always stress. For many people, it is a sign that intracranial pressure has built up during sleep because blood is not draining efficiently from the head. Research published in the Journal of Clinical Sleep Medicine found that even a modest elevation of 15 degrees significantly reduced this pressure and improved blood return to the heart in older adults. That is a small change with a meaningful impact. The fix is straightforward, and I will give you the exact recommended positions at the end of this video. But first, let us move to number 4, because this one applies to a very large number of people and is almost never discussed. Position number 4 is sleeping on your right side, particularly if you have any history of heart issues or high blood pressure. Now, I understand that right side sleeping feels comfortable and harmless, but I want to walk you through the anatomy, because once you understand what is happening inside your body in this position, you will not look at it the same way. Your heart sits slightly left of center in your chest. When you lie on your right side, your body weight shifts, and a large vein called the inferior vena cava, which runs along the right side of your spine and is responsible for returning blood from your entire lower body back to the heart, can become mildly compressed. Even mild compression means your heart has to work harder to pull that blood back in. For a healthy person in their 30s, this extra workload is barely noticeable. But for someone over 60 who's already managing high blood pressure or any degree of reduced heart function, adding 7 hours of extra cardiac workload every single night is meaningful. It is not a dramatic event that you feel in the moment. It is a slow, cumulative strain that builds night after night, year after year. Cardiologists have observed something interesting. Patients with heart failure very often instinctively stop sleeping on their right side because it feels uncomfortable. Their body is giving them a signal. Most people without diagnosed heart failure never receive that signal. So they continue in the position without any awareness of the strain it creates. A study published in the European Journal of Heart Failure found that left side sleeping was associated with better blood flow stability and less overnight strain on the heart compared to right side sleeping. We will come back to why left side sleeping is so beneficial when we get to the recommended positions. If you are a right side sleeper and you have high blood pressure, please make a note of this and bring it up with your doctor. Position number 3 is using too many pillows stacked under your head. This one is very common, especially among seniors who use extra pillows for comfort, for breathing ease, or for managing acid reflux. Some elevation is genuinely helpful, and I will explain why shortly. But stacking 2, 3, or 4 pillows creates a specific problem that most people never consider. When your head is pushed too far forward by a high stack of pillows, your neck bends at a significant angle. Running alongside both sides of your cervical spine, the bones in your neck are a pair of blood vessels called the vertebral arteries. These arteries supply blood to your brain stem and cerebellum, the parts of your brain responsible for balance, coordination, and basic life functions like breathing and consciousness. When your neck is pushed into an exaggerated forward bend for 8 hours every night, these arteries can experience compression. You will not feel it happening. There is no pain signal from the arteries themselves, but over time, reduced blood flow through these vessels means reduced oxygen delivery to the lower portions of your brain. The effects show up as morning stiffness, a dull ache at the base of the skull, or that foggy, unrefreshed feeling that too many people simply accept as part of getting older. I have spoken with patients who had suffered from daily morning headaches for years. In several cases, switching from a stack of pillows to a single properly contoured pillow resolved the headaches within a week. Not because of anything dramatic, but simply because the neck was finally in a neutral position during sleep, and blood flow through the vertebral arteries was no longer being restricted. The goal is gentle elevation of the entire upper body, not just the head. I will show you exactly how to achieve this safely in the recommended position section. And now we are at position number 2, which is something a very large percentage of older adults do every night without realizing the effect it has on their breathing and circulation. Position number 2 is sleeping in a tightly curled fetal position. This position feels instinctively safe and comforting. Curled on your side, knees pulled toward the chest, chin tucked down. Many people sleep this way for their entire adult lives, but from a physiological standpoint, this position creates 2 significant problems for people over 60. The first problem is breathing restriction. When you curl tightly, your rib cage compresses. The lungs cannot fully expand with each breath. Throughout the night, every breath you take is shallower than your body actually needs. Multiply that by thousands of breaths over 7 or 8 hours, and the result is a meaningful reduction in overnight oxygen intake. For someone with any degree of cardiovascular disease, lung disease, or even just the natural changes that come with aging, this reduced oxygenation puts stress on both the heart and the brain. That tight feeling in your chest when you first wake up, the feeling of needing to take a deep breath before you can get going, is often the result of a night spent breathing in a compressed position. The second problem is vascular. When you curl tightly, the muscles of the neck and upper back remain contracted throughout the night. That sustained muscle contraction puts pressure on the small blood vessels around the base of the skull and along the cervical spine. The result over time is reduced blood flow to the lower brain. The adjustment here is not about giving up side sleeping entirely. Left side sleeping is actually one of the best positions, as we will discuss shortly. The adjustment is simply about keeping the body more elongated, with a pillow between the knees to support spinal alignment, rather than curling the entire body tightly inward. Now we arrive at position number 1, and this is the one I want you to take most seriously, because it combines several of the risk factors we have already discussed into one nightly pattern that is surprisingly common. Position number 1 is going to sleep within 2 hours of eating a large meal, especially when alcohol is involved. I know this one feels different from the others because it is more about timing than body position, but the cardiovascular effect during sleep is serious enough that I consider it the number 1 habit to address. Here's what happens inside your body in this situation. When you eat a large meal, your body redirects a significant amount of blood to your digestive system to handle the work of processing that food. This is completely normal, but it means less blood is available for your brain and other organs in the short term. In younger adults, the body compensates for this shift easily. In older adults with narrowed or stiffened arteries, this redistribution can cause dizziness and lightheadedness. And in some cases, when combined with other risk factors, it can contribute to dangerous drops in blood flow to the brain during sleep. Now add alcohol to that picture. Alcohol causes your blood vessels to dilate and your blood pressure to drop. For someone with healthy, elastic blood vessels, this feels relaxing. For someone over 60 with any degree of arterial stiffness or plaque buildup, a sudden blood pressure drop triggers a compensatory spike as the body tries to correct it. That cycle of dropping and spiking blood pressure throughout the night is stressful on vessel walls, and in areas where blood flow becomes turbulent and erratic, the risk of clot formation increases. A study published in the American Journal of Hypertension found that even moderate alcohol consumption close to bedtime disrupted the natural nighttime blood pressure dipping pattern that the cardiovascular system depends on for overnight recovery. When that dipping pattern is absent, the heart and blood vessels do not get the rest they need. The recommendation here is simple. Finish your last meal at least 3 hours before bed. If you drink alcohol, aim to stop at least 4 to 5 hours before sleep. And after dinner, take a short 15-minute walk. That gentle movement helps your body begin the digestive process efficiently, brings blood pressure down naturally, and signals to your nervous system that the day is winding down. Now, let us talk about what you should actually do, because information without a practical path forward is not very useful. The first recommended position is left side sleeping. When you sleep on your left side, gravity works in your favor rather than against you. Your heart sits slightly left of center, and in this position, blood returns to the heart more efficiently from the lower body. Your heart works less. Blood circulates more freely. Your brain receives better oxygen delivery through the night. Beyond the cardiovascular benefits, left side sleeping appears to support the brain's glymphatic cleaning process, the system we discussed at the beginning that flushes out the toxic proteins associated with Alzheimer's disease. This is not a minor benefit. This is a process that happens every night and has implications for your cognitive health over the coming decades, not just tonight. Left side sleeping also helps keep stomach acid down for people who deal with acid reflux, which is common after 60. The anatomy of the stomach and esophagus means that lying on the left side naturally reduces the chance of acid traveling upward during the night. If you have been a right side or back sleeper for many years, the transition takes time. The most practical tool for making this change is a body pillow. Hugging a long pillow in front of you keeps your body naturally positioned on the left side and prevents you from rolling over unconsciously during the night. A smaller pillow placed between your knees supports spinal alignment and takes pressure off the hips and lower back. You will roll over sometimes. That is completely normal. The goal is not perfection. The goal is spending more of your sleeping hours in the optimal position than in the harmful ones. The second recommended position is back sleeping with gentle elevation, not flat, not sitting upright, but a gradual incline that raises your entire upper body between 15 and 30 degrees. This can be achieved with a wedge pillow, an adjustable bed, or carefully arranged pillows that support the back and shoulders, not just the head. This position works well for three specific reasons. First, it helps blood return from the lower body to the heart more efficiently, which reduces the workload on the cardiovascular system through the night. Second, it reduces pressure inside the skull, which is particularly important for people with high blood pressure or fragile brain vessels. Third, it keeps the airway more open, reducing snoring and improving overnight oxygen delivery. For people with mild sleep apnea or chronic sinus congestion, this can make a meaningful difference in how refreshed they feel in the morning. One important detail: if you elevate your upper body, place a small pillow under your knees as well. This maintains the natural curve of the lower spine and prevents you from sliding down during the night. This position is not ideal for everyone. If you have severe sleep apnea, left side sleeping is likely a better choice. If you have significant shoulder arthritis, the wedge position may offer more comfort than side sleeping. Your specific health situation should guide the decision, and your doctor is the right person to help you figure out what works best for your circumstances. Let me also mention a few simple bedroom adjustments that directly affect your overnight cardiovascular health, because even the best sleep position will not fully compensate for a sleeping environment that is working against you. Keep your bedroom temperature between 64 and 68 degrees Fahrenheit. A cooler room helps your core body temperature drop naturally, which triggers deeper sleep and lowers nighttime blood pressure. If your room is too warm, your body works harder to regulate temperature all night. Your heart rate stays elevated, and you never fully reach the deep recovery stages where real healing occurs. Avoid bright screens after 9 in the evening. Phones, tablets, and televisions emit light that suppresses melatonin production and delays the onset of deep sleep. The deep sleep stages are precisely when your brain clears its waste products and your blood pressure achieves that important nighttime dip. Protecting those stages is worth the effort. Use a single, properly contoured pillow that supports your neck's natural curve without pushing your head forward. Memory foam pillows with a cervical contour design are worth looking into if you have never tried one. The difference in neck position during sleep can be significant for blood flow through the vertebral arteries. Finally, consider your noise environment. Even sounds that do not fully wake you can pull your body out of deep sleep, causing brief spikes in heart rate and cortisol. A white noise machine or simple earplugs can create a consistent, calm sound backdrop that protects the quality of your deep sleep throughout the night. Now I want to hear from you. Which of these sleep habits do you recognize in yourself? And which one adjustment are you going to try first? Tell me in the comments below, because your experience genuinely helps other members of this community recognize patterns they may not have considered yet. Remember, this video is for educational and informational purposes only, and is not intended to diagnose, treat, cure, or prevent any disease. Please consult your personal doctor or a qualified healthcare professional before making any changes to your health routine, especially if you have existing cardiovascular conditions or a history of stroke. If you found this video helpful, don't forget to subscribe to Dr. Michael Lin Senior Health and hit the notification bell so you never miss a health tip. I'll see you in the next video.